So when you look at young doctors entering the profession today, do you feel their journey will be easier than yours or in some ways even more complicated?
No, it's actually a mixture of both because nowadays when they start their journey.
So what is the role of social media influencers in misleading the patients?
They are not qualified to give such comments. Actually, they go in a confused state of mind, whether to, believe the influencer or to believe the doctor.
So for the very first episode of Beyond the White Coat, it is a privilege to begin with someone who is widely regarded as one of the doyens of dermatology and the most respected and influential dermatologist in India.
Thank you,
Yes.
Dr. Ashwath, for having me here.
Yes. Dr. Maya Vedamurthy is the founder of RSV Skin and Laser Center, a dermatology center she established in 1988, which has since grown into one of India's most respected dermatology institutions, serving patients for more than 3 decades. Over the years, she has presented several papers across the world, delivered prestigious orations, and received numerous honors, including the Economic Times Inspiring Dermatologist of India Award. Welcome, ma'am. It's a pleasure having you here.
Thank you. Thanks, Dr. Ashwath.
So before we talk about the dermatology and the work you have done over the years, I'd like to go back to the beginning of the journey.
See, actually, I took up dermatology thinking it's just a traditional medicine, meaning that there are no emergencies, no late night calls. And I thought I would really have a lot of time for myself.
Okay.
But the revolution and evolution dermatology has taken. And therefore, I find myself actually on the reverse. From a quiet life in a village, I've come to a life in a jostling city like this. And my career actually occupies most of the time in my life.
No. So can we go back to your roots, ma'am? So where were you born or where were you raised up?
Sure. I was born in a village called Ainambakam, and my parents' dream was to educate me, but they never knew I was going to be a doctor.
Okay.
So once I started studying in school, everybody told me that I'm a bright student. I should either do IAS or become a doctor. Okay. So this thought went into my mind, and I realized that being a doctor, because I've seen doctors treating patients in my family, so I thought that would be the best occupation for me. So I just studied well, and those days it was purely merit. Okay. There's no other way one could fetch a seat. And my marks took me to Madras Medical College, which I nearly loved, and that I continued to do even my post-graduation in Madras Medical College. So I'm purely a student of Madras Medical College and purely out of merit.
Okay, very inspiring, ma'am. So we'll go to the first question. So if you met the younger version of Maya, who was starting out in medicine, what do you think would surprise her about the life you're living now, or the life you have built now?
I was actually inclined to have a quiet life with no emergencies and no night duties. And that's the reason I chose dermatology, because by the time it was time for me to choose my professional upgradation, I had 2 children. I was a mother of 2 kids. So,
okay. So before
I got married in 3rd year. I delivered
MBBS.
my child in my first son in final MBBS.
Okay.
And my second son was born while I was doing my diploma in dermatology. So I wanted to be partly a housewife and partly a professional. Okay. But now it looks like there's no time for myself. It's fully oriented towards my profession now. So if the younger version looked at me and said, hey, is this what you wanted to be? But it's not what you wanted to be now. So
when you first begin your dermatology journey, did you feel confident of the future? Or was there a lot of uncertainty in those early years?
Definitely there was a lot of uncertainty because, as you know, that our only medications were just some ointments.
Yes.
And the maximum we could go up to was either steroids or methotrexate. And I did not know what percentage of my patients would be purely dermatology, what percentage of my patients would be venereology and leprology. Thanks to the leprosy eradication program, leprosy cases have come down drastically. And with HIV medicine picking up, the venereologists were treating all HIV and other sexually transmitted diseases. And we started treating purely dermatological cases. And then dermatology branched off into several medicines like pediatric dermatology, geriatric dermatology, we have trichology, we have oncology, we have psychiatric dermatology. And now we have a whole lot of specialties, subspecialties like procedures, aesthetics, lasers, and even dermatosurgery.
Yes.
So there has been a radical change, a 360 degrees change, a sea change, I would say.
Okay. So inspiring. So looking back now, do you think that uncertainty actually helped the path? It shaped the path you took?
Definitely, the uncertainty made me actually drive towards the latest in medicine, the updates that I went to after my MD general medicine, MD dermatology. I went to Cleveland Clinic because I knew this updates.
So you went to the US?
I went to the US for a month's training. And there I was exposed to a lot of procedures, like all the lasers, the injectables, and even hair transplant. I had an observership in a hair transplant center.
In Cleveland? Okay.
In Cleveland.
Okay, but that is very inspiring.
That is why, yes. And then I went to Singapore Therapy Update, where again I was trained in chemical peels and mesotherapy, even in those days in 1995. Because I knew it's going to take a long time for us to get those things in India. So I just thought the only way for me to keep updated was to go out and explore.
Okay. So when you look at young doctors entering the profession today, do you feel their journey will be easier than yours, or in some ways even more complicated?
No, it's actually a mixture of both. Because nowadays when they start their journey, knowledge is at their fingertips. They have access to many things, unlike us, and they travel lots to attend conferences because there are so many opportunities which have come up now, and they have everything in the iPad or mobile,
and AI as well.
then AI as well to help them with whatever they want to know. Whereas those days we only had to go to the library to get books and read, and we only had textbooks. Even journals, we were not able to get all the journals easily as we are getting today.
Okay.
At the same time, the challenge is very difficult now. One is because of the competition, not only amongst the dermatologists, they also have to compete with beauticians, with quacks, because, our country is full of quacks, and then the kind of price conscious patients that we have today. So, and then the expenditure it takes for them to build a clinic with all the lasers and technologies that are needed to treat any dermatology patient. So it's actually a mixture of both. It's both hard and it's both easy.
So every generation seems to face a different form of complexity. Okay. Since we spoke about AI, so how has AI transformed your practice?
Actually, now we are actually just beginning to use AI in our practice. One, it's mostly for learning purposes that all my postgraduate students, they use AI because they can get a lot of information just at the tip of a button. And then we are not actually translating it to patients' practice perspective. We are using it mainly for learning purposes. We are not using it to diagnose skin conditions because, the AI skin app is not so evolved as the other things. So we are not depending on AI for that.
So what do you feel is the future of AI in dermatology?
See, now I feel there's a lot of hype about AI, and I do not know whether it will plateau or it will have a downfall because it definitely cannot replace human minds. And another thing is the experience. For example, AI can just give you a differential diagnosis. It cannot pinpoint the diagnosis.
Yes.
And it cannot study the patient's history as a whole. Because when you apply to the patient, it all depends on what kind of patient you have, what the patient can actually receive for the treatment. AI cannot judge and analyze as a human being. So I don't think AI can ever replace a human being. But definitely it will help. So we cannot do without AI. At the same time, we cannot solely depend on AI for our practice, at least for medicine.
And regarding the AI in research, so is it a boon or a bane in research?
In research, definitely it's a boon, because you can come out with new findings and it will be able to retrieve data from all the sources. I think AI is definitely there to help us in research.
And regarding the quackery practices, since you mentioned, so what has the government done regarding the practices or the Academy of Dermatology?
As an academy, we are promoting patients' awareness. We have actually released one in our website also recently to say how you can identify a true dermatologist based on the registration number, or if they go into the website, if they type in the name, it will actually give you the qualification of the dermatologist and also a number given by our society. So that way the patients can actually find out if they are going to a fake dermatologist or a true dermatologist. The government, thankfully, has brought out a law that aesthetics and hair transplant and other procedures can only be done by qualified dermatologists who hold either a diploma, a DNB, or a master's degree in dermatology, and it cannot be done by anybody and plastic surgeons. Other than these two categories, it does not permit anybody else to do these procedures.
It's pertaining to hair transplant.
Mainly hair transplant, but they've also included aesthetics, lasers, aesthetics, and procedures. They've put in a broad category.
So you're telling that a cosmetology degree won't help. They can't.
They cannot. It is illegal.
It is illegal
according to the government.
So what are the myths regarding the commonly seen in practice regarding dermatology?
See, one thing, as I told you, like they think for all dermatological diseases, we treat them with steroids, which is not true. Earlier days, we did have steroids, but it was not misused. And now we don't have the need to use steroids for most of our diseases, which were previously treated with steroids. Now we have other safer immunosuppressive agents. We have biologics. We have small molecules. So we have so many safer medications to treat our patients. And we also have some equipments now to treat them. Like we have lasers to treat. So for laser hair reduction, we have lasers. We don't have to treat them like people used to think that only steroid is the treatment of choice. Another thing is they thought skin diseases can never be cured. They always thought if it's a skin disease, it's a disease forever. But now we have proved that we could cure most of the diseases. So I think there is a whole lot of myths that were there.
So when you opened the RSV Skin and Laser Center, did you feel more excitement or more fear taking that step forward?
It was a mixed feeling. Because
so it must have been a big investment, right?
Of course, that is what I'm saying. It was a mixed feeling. Because one, I finally thought I have a place where I could do what I want to do. And I thought I was a boss. Right? But then the flip side is there was a lot of responsibilities, financial commitments, and then having staff to work under you, mentoring people, staff, your students, because I also have fellowship course there. And it's a lot of responsibility to make decisions on your own, both administrative, financial, and the way we treat patients, because it's a different game altogether, having a center of your own.
So did you have anyone to help you out regarding the administration?
It was only my husband who used to help me with the financial advice. But administration, it just came out of my practice and my experience of working in corporate hospitals. And actually, I started my life in a government service. When I was doing my diploma in dermatology, I appeared for TNPSC exam. You know,
Okay,
those days
that's interesting.
we had exams.
Okay,
I passed the exams and attended interviews. Then I was selected and I was posted in primary health center.
okay,
And in one episode, I actually had to open up a new primary health center in a place where the PHC was allotted.
yeah, okay.
That gave me a lot of administrative capabilities. And also we had to meet targets, especially family planning target was given to us. And so there was only a gynecologist and myself posted in that center.
Okay.
I was sent to Kasturba Government Gandhi College to train in anesthesia. So I used to give anesthesia. We were so bold. I used to give anesthesia to the patient, and then I used to wash up to help with tubectomy. So multitasking, reaching targets were all trained because of my postings in a government medical
So that has helped you out.
setup.
Yeah, okay. So there's a lot of uncertainty.
Definitely.
Was there a moment early that you regretted early in a career that you regretted you opening a center?
Not really, except when I thought it was very difficult to find the right staff because I had a lot of expectations from non medical people, because we view our patients differently. Their commitment to patients is something different. They don't treat them the way we want our patients to be treated. So that's the only time I used to regret I'm not able to handle the staff the way I want them to be.
So what helped you move through that phase?
In fact, I used to read a lot of books and
All
then
personal growth.
personal growth. And then I also used to talk to people who are in a similar situation. And I always used to find out how they are able to retain their staff, train their staff, and keep the center upgraded.
Okay. So when someone, a young dermatologist, decides to start a center today, what do you feel people most commonly get wrong at the beginning?
See, you have to take baby steps first, and then you walk. But what they do now is they run and they jump.
Okay.
You have to start small. But now waste a lot of money on infrastructure. They want to buy all the fancy lasers and then they get stressed. Then everything becomes a nail for the hammer.
Okay.
So they start using their machines inappropriately and then they land up in trouble. And then they don't get them well trained or well read before they start these big things. So I think they have to spend some training after their post graduation to learn, what's best for patients, because, they're all driven by the laser companies or by the vendors. I think that amount of training they have to get before they choose their right equipment, right technologies. I think that is a mistake.
So regarding the mistake, since you spoke, so why do you think people continue to make that mistake, even though they know that this is a big step? Why do people continue to do it?
I think the younger generation are in a hurry, either to get a name, fame, or money.
Okay.
They don't have the patience. Straight out of college, they just want to become big
They want to
consultants.
start a center.
Yeah.
Okay. So it's you built over 30 years.
Yes, my first center was just 820 square feet.
Okay. Oh, amazing. So what is something about running a medical practice that people outside medicine rarely understand?
See, people always look at doctors and they think they just make a diagnosis and they give a treatment.
Okay.
What they forget is that the courage that the doctor needs to make that diagnosis and to give that particular medicine, is something which can only come with years of hard experience, and education. It's just not looking and writing, especially, ours is a visual specialty.
Yes.
So if you look and write, they think it's so easy. They're just looking and they're writing and they're giving us treatment, and for which they are charging. But that's not true. It's the amount of expertise or the confidence or the courage you need to make that diagnosis. Because if you make a wrong diagnosis, your treatment is going to be wrong.
Okay.
And then even after giving them medication, we are responsible. We always sit and wait to see the responses more eagerly than the patient. And they also forget the emotions that are involved, in us when we treat patients.
Okay.
We always wait for them to get better. We want to see the results. We want them to come back to us with a positive note or with a happy note. It just doesn't end with a prescription.
Okay. So there's a common myth that dermatology is expensive, the treatment.
Exactly. That's what they think. And they think it's just a visual specialty. They're just seeing, and sometimes they say that they don't even touch them. I mean, it's not that all of us do that.
Yeah, we need to.
We need to.
Yeah.
But that's a common myth that people have
Okay.
with dermatology.
So regarding your patient encounters, so was there ever a patient encounter that stayed with you long after the clinic closed for the day?
Oh, there's been several
Yeah,
times.
there'll be
Almost every day, I think I'll think of one patient.
So something has to be memorable, right?
Something has to be memorable. Of course, it'll be both positive and negative.
Okay.
Sometimes I've had patients who have come and said that they have never slept for several months, but after the treatment, they've just slept peacefully. And they come and thank me profusely.
Okay.
And then there has been my vitiligo patients. After treatment, they've come and told me that the girl who refused to just budge out of the house is now socializing very well.
Okay.
And the parents come and thank me profusely.
Okay.
So when I go home, I'll be thinking, oh my God, this makes a lot of difference. Because, all of us dermatologists are emotionally sensitive also.
Okay.
Whether they make a positive comment, we are excited. When they make a negative comment, also we are, kind of affected. And the negative thing is some patients come with a lot of frustration, with a lot of stress. The moment they enter, they pick up a quarrel with the receptionist. And then they pick up a quarrel with my staff, with the nurses.
So how do
Everybody
you
that
handle all this?
comes their way is their enemy. They look at them as their enemy. After all, those girls come for their livelihood. And there's no personal thing against any. And they'll come, and the moment they see me, they won't even talk about their complaints. They will talk about my staff, complain about my staff.
Okay.
Only after 5 or 10 minutes of complaining about my staff, they'll start talking about their skin complaints.
Okay.
And it is hard for me to tell them that these are things, trivial things. And of course, I would be counseling my staff. The moment they leave the place, my staff will be called. I will inquire and I will counsel them also. Sometimes my staff starts crying when I ask them, or when I get angry with them for behaving rudely according to the patient. Because these are also young girls. They're all not trained in psychology. So I have to counsel my staff and make sure that after counseling my patient, I have to counsel my staff and make sure that they don't repeat those mistakes. But sometimes they're not intentional mistakes.
Okay.
But the patient takes them, to heart.
So it is very
It
difficult.
is when I go home, I'll be thinking, oh my God, how can I solve this problem?
Okay.
It's very difficult for me to, handle the situation.
So over the decades, what do you feel has changed about dermatology? The dermatology itself or the patient's attitudes toward dermatology?
Both has changed.
Okay.
One, dermatology treatments have become very expensive. Even the tests are so expensive. These are specialized tests which are not available in common labs. They have to be sent to specialized centers. And then the medicines, the biologics actually run into several thousands.
Mm.
But then they are the only medicines which are able to help most of our patients with psoriasis,
Okay.
and vitiligo. And these are conditions which require those medications. And nothing is in our hands. There's no way that we can help our patients except by telling them that we could probably treat them with the less expensive medications if they cannot afford, or send them to government hospital where these medicines are available free of cost to our patients.
Even the biologicals are available.
Biologics are available in government medical colleges. It's a really good thing that the government hospitals have been funded and have been supplied with these expensive medications. So I'm able to help them by sending them there.
Okay.
And of course, these newer technologies like forever aesthetic condition that we need, like the skin tightening, or we have injectables like botulinum toxin, and we have hyaluronic acid injectables,
Okay.
which are able to help our patients.
So do you sometimes feel that medicine is today is becoming more commercial than it used to be?
It's really not true with all the patients. I mean, all the doctors. And patients also, the patients nowadays are totally different. They have no patience. They want instant gratification. They want discounts. And they are influenced a lot by social media,
Influencers.
by influencers, and all these marketing gimmicks. And they think they know more than us. And this AI has also entered the picture.
Okay.
So they read Chat GPT, they read the side effects of all the medicines that we have given them, and they come back repeating the same thing. So it is very difficult for dermatologists to treat patients. And then if they want safe drugs, the safe drugs are slightly more expensive than the conventional drugs. So again, they think the doctor has become commercial. No, it's actually a misconception.
Okay.
In the public, that doctors are becoming commercial, which is not true. And a doctor, for example, has the patient wants a diagnosis and they ask, "Are you sure? Is it 100% correct?" And then what will you do? We have to save our skin. We have to do the tests.
Okay.
What we were doing in the past without testing. Now we do the test just to protect ourselves and also to satisfy the patients. And then they call the doctor is commercial. So
But
it
that's
is a difficult situation.
That's a common conversation happening among the patients in all the medical fields, not only
Yes.
dermatology. So, what is the role of social media influencers in misleading the patients?
I think they actually ruin the practice.
Okay.
They give, first of all, they are not qualified to give such comments, at least about medicines and medical therapies. But our patients are so tuned and they are ready to listen to the influencers than the doctor himself.
Okay.
So actually they go in a confused state of mind, whether to believe the influencer or to believe the doctor. So I think they actually cause confusion in the patient's mind.
So they're in a dilemma.
They're in a dilemma.
Okay. So regarding your entrepreneurship, so what is something about success in medicine that people rarely talk about?
See, people rarely talk about the satisfaction that a patient or a doctor gets out of the doctor-patient relationship. They always value success with money. It's not about money. Success is not about money.
Okay.
It is just how happy one is, or how passionate one is about the subject. Only then you can sustain in this. Otherwise, if you don't read, or if you don't show empathy towards your patient, you cannot be successful. And money cannot buy everything. Money cannot buy the happiness one derives, as I mentioned earlier. When a patient comes and tells you how happy they are with the treatment, money cannot give you that happiness.
Okay. So there's something people rarely talk about.
That's right. People don't talk about, and they don't talk about the emotions involved in treating a patient.
Okay. So looking back, what does success mean to you today compared to what it meant earlier in your career?
Earlier, I thought, as everybody thinks, I thought just seeing number of patients is success. To be well known is success.
Okay.
So I used to think you have to be really well known. You see maximum number of patients.
Okay.
But now I feel success is not about seeing number of patients.
Okay.
Success is how well I deliver my treatment. I want to really follow all the SOPs now. I want to really follow the West, because I feel West is a lot advanced in the number of medicines, the newer medicines they use, the better results they give. So I feel success in bringing the best to our country. My thoughts have really changed. I want to
That's
bring the
very
best.
inspiring. Yeah. So, since you spoke in detail about dermatologists rushing into opening a center, so how important is financial literacy for a dermatologist or any young medical practitioner?
It is as important as the subject itself.
Okay, yeah, great.
Because very sadly, nobody spoke to us in our medical college about setting up a practice.
Okay.
I wish there was a topic how you set up your practice, how you manage your finance. And that is very important because nothing can happen without money.
Okay.
And not everybody comes from a business family, right? So it's not inborn in them. So knowing about finance and how to manage a clinic successfully with limited resources is something one should learn. I wish there was an MBA. I also attended this Ahmedabad IMA for for a short course.
Okay.
And then I realized that there are so many things
that we don't know.
I didn't know. And there was so much to learn. And of course, we are still, I think doctors are not good business people.
Okay, but everyone is aspiring to be a good businessman in
Exactly.
dermatology, especially.
That is why I think it's challenging.
So let's come to the final question. After all the roles you have played, doctor, teacher, mentor, and a leader, who is Maya Vedamurthy beyond the white coat?
Beyond the white coat, I feel I'm still a student, ever ready to learn. I love attending conferences. I love learning new things and I love doing new things.
Okay.
So I think, and then the next step is to be a teacher.
Okay.
Trying to impart whatever knowledge I have gained in the past. I would love to be a teacher. And beyond the white coat, I'm still a student, will remain a student, and would love to be a teacher.
Okay. Okay, doctor. Listening to your journey today reminds us that a career in dermatology or medicine is not only about treating illness, it is also about the institutions that are built, the knowledge we pass on, and the generation of doctors and patients who continue to benefit from the work. So it was a pleasure listening to you, madam. Thank you.
Thank you so much.
Thank you for joining us
Thank
today.
you. Thank you.